For myself, I would just like to say welcome. I'm Eva Wickwire. I'm the Chief Development Officer here. It's been a few years coming for this moment in time, so thank you all for helping us celebrate and for all everybody did to make this moment possible. Mary Jones.
Thank you very much. Thank you. Well, exciting things of this magnitude do not happen without a whole lot of time, without a whole lot of resources, and a whole lot of wonderfully committed people. And I am so pleased to have a chance to introduce some of them today, starting with a woman. When I heard that my old friend was involved with this and very much behind it, I said to myself, well, of course she was. And when I heard that her organization was behind it and so committed to it, I said, of course it was. She is an amazing woman, an amazing leader. She's CEO of the Beekley Corporation. Phenomenal company, and what she has done with the company is just phenomenal. Anne LaPlante.
Thank you. Good morning, everyone. It is a great day to be here, and I am thrilled and proud to see this beautiful vision transformed into reality. It is beyond expectation. I have seen it in various stages, and today was the final stage where I got to see the sign, the furniture, the equipment. It all came together with all the touches, and the team here is just amazing in what they do. And we now have a world-class breast health and wellness center in our Bristol community. At Beekley Corporation, for those of you who might not know what we do at Beekley Corporation, we are in business to help save lives and provide better patient care with our mammography skin markers and visual communication system. Beekley Medical has spent countless hours over the past 30 years teaching our customers how to better detect possible cancers. Mason Beekley was the visionary genius who created the entire industry of skin marking for mammography. Mason died in 2001. If he were here today, he would tell you how grateful all of us at Beekley are for our partnership with Bristol Hospital. It has been an honor and pleasure working with them the past 4.5 years to bring this dream to life. They are a pro team, and they have thought of everything. I have not ever worked with a more committed and passionate team to, again, bring this dream to life. They are amazing. If Mason were here today, he would be humbled and proud that his company's name will be forever at the entrance of the Beekley Center for Breast Health and Wellness at Bristol Hospital. On behalf of Mason Beekley, the Beekley Family Foundation, and for the hundreds of Beekley associates who over the years acted as missionaries in our joint venture to defeat breast cancer. We are honored today and flattered to have our name, Beekley, adorn this wonderful place. I have the privilege to introduce the youngest daughter of Mason and Leisha Beekley, one of the 4 shareholders of Beekley Corporation, and a breast cancer survivor. Francie Beekley is here today to share some of her special thoughts on this occasion.
W. Mason Beekley III and Leisha Corrier Beekley. My deceased parents would be thrilled about the opening of the Beekley Center for Breast Health and Wellness at Bristol Hospital. Our mother was a breast cancer survivor in the late 1960s, and I survived breast cancer in 2010. We have all been touched by breast cancer and seen people we have lost, unfortunately. In memory of my parents, this new, beautiful, state-of-the-art healthcare facility reflects their belief in giving back to our community and making a better future for everyone. It is a great honor for me to thank all of you involved in making this project possible on behalf of the Beekley Family Foundation, myself, and my 3 sisters. Thank you.
I have to tell you, this is probably one of the most exciting days that I've spent here at Bristol Hospital. For me, personally, my awareness of breast cancer started when I was probably 19 years old. I was working at Fox Chase Cancer Center as a patient transport, and one of the patients was my grandmother. who was very, very special to me. She taught me how to drive. She taught me how to plow a field. She taught me a lot of things, believe it or not. And she lost her battle. But in that environment, much like this environment, not as nice as this environment, but close, I was exposed to cancer patients every day. And what I learned was how important it was to make the environment that they were in feel like home, feel like the environment that they were living in before they got into the hospital. And so that has been the thrust. And fortunately, the contractor, ACG, and his team, Bill's team, and Fletcher Thompson, the architects, and the oversight committee, the steering committee, worked together to create an environment that hopefully reduces anxiety for patients, that makes them feel warm and welcomed, and takes some of that sterile feeling that you often get in a hospital away, and helps actually, I believe, improve the healing process for folks, and makes them possibly feel more comfortable having a screening exam done. So the experience is actually better. So from every aspect, this center has been designed to enhance and really develop the quality of the healing process. So I have to really put my hat off to the people that designed it, the oversight committee, and most importantly, the contributions and the determination of the Beekley Corporation and the sisters, because it wouldn't be a reality without that. There's no question that your contribution, the lead contribution, made this a reality for the folks of this community. And thank you. So, in my career, this will be the third breast center that I've had the pleasure of being involved with the construction of. And during that time period, I've probably visited, I would say 12, maybe 14, with teams of individuals, cancer survivors, breast cancer survivors. And bar none, this is the most incredible center I've ever stepped my foot into. It is absolutely the best. So thank you again so much for making this a reality. I would be remiss if I didn't talk about the internal crew, our facilities crew, and the staff that have worked so diligently to add the finishing touches here. Over the last few weeks, there have been staff in here putting magazines up. There's been staff making sure the equipment is working right. There was staff that prepared the food that's over there today. And also the volunteers who will help staff this center. So big round of applause to all the staff. And also our medical staff, many of whom are here today. We are blessed with an incredibly talented medical staff. Folks like Jim Sayer, who are passionate about breast cancer, have helped lead the charge internally. I've helped also raise money from other donors that made this a reality. I'd point out this plaque over here. It took a whole community to do this, a whole community, with, as I said, the start from the Beekley Corporation. And the medical staff here, I can tell you, bar none, is one of the best I've ever worked with. With the addition now of Dr. Varanasi, our fellowship-trained breast surgeon, who will be in this center. Take care of patients. I do believe in divine intervention, and she came to us just as the plans for this were starting to come to fruition as we were finishing the lab move and clearing out the space, so we're really pleased to have you here. I'd also want to take a minute to recognize some of the dignitaries in the crowd. Mayor Art Ward is here. He's going to speak, right? Mayor Art Ward. And in the back of the room, usually it doesn't matter where you're standing with, we can all hear you. Representative Whit Betts. And as Mary encouraged you all, please walk around the center and grasp the totality of it. This is a truly incredible place. It's a one-stop shop. I'm hoping that I'll be able to go back and enjoy the lounge with the fireplace sometime, but I don't think that's going to happen. The robes look great, and I mean, maybe after hours I can slip in here. I don't know, but thank you all so much, and enjoy this. Enjoy your time here today. Mary, back to you.
Today is a great day. There's a semblance here. The first 3 weeks that I was in office, I had the opportunity to meet Ann LaPlante and tour the Beekley facility as they were preparing to move into the new facility across the street. And here it is, roughly 3 weeks before my terms are up, and we have this occasion, which is absolutely phenomenal, and attests to you and your employees and your staff for their dedication to the community. We thank you. I think we'd have a hard time finding anyone here today that hasn't been touched by breast cancer. Family, people that you know, the neighborhood, whatever the case might be. Myself, 40 years ago, my mother was diagnosed, and they gave her 6 months to a year to live. And she was fortunate because she lived another 17 years. And when I think about that, that's the amazing part. But to think about what the opportunities are today with medical technology and facilities such as this, and to think for this hospital to have the opportunity to have a facility like this for the patients that they treat. I can personally attest to the expertise and professionalism of the staff of this facility. And I can only dream of what this is going to mean to the numbers of people that come through that door. So on behalf of the City Council, the citizens of Bristol, Ann, we thank you from the bottom of our heart.
Good morning, everyone. So Kurt actually said it, divine intervention, and I believe in divinity. So I think we are all here for a bigger cause today. So let me just say that it's a pleasure to see so many of you here today. I'm sure many, or almost all of you, have very important matters to take care of and are running a tight schedule. In spite of that, you've made a commitment to be here today as Bristol Hospital celebrates its dream of a breast center for the community, by the community, come to a reality. It's truly very inspiring, encouraging, and also humbling to see all the support we have to fall back on. I do not have to emphasize, nor do I have words to express how much the Beekley Foundation means to us, helping us make the history in the annals of Bristol Hospital. Thank you very much. The health and wellness aptly describes the belief that breast care is not about cancer alone, but recognizing the risks that increase the risk of breast cancer, and also identifying people who are or who could be at increased risk for breast cancer. So our mission is to provide for care as and when needed in the form of same-day reporting the test results and performing procedures as soon as we identify them. To achieve this, I think having radiologists and surgeons at the same level and in the same building contributes to a significant dimension to patient management. The mission is to provide integrated care between radiologists, pathologists, surgeons, and many multidisciplinary teams involving other specialties like radiation oncology, medical oncology, plastic surgeons, genetic counselors, cancer care coordinator, and a survivorship program. Genetic testing of high-risk group of patients, bone densitometry, I know the unit is up and running already, nurse coordinator and navigator to walk patients through their most testing, confusing, and difficult times. I aim to get the center accredited by the NAPBC, making it a center of excellence and recognition nationally. Organize for a Bristol Hospital breast cancer walk annually. My suggestion is to call this walk Walk for Recovery, Walk for Awareness, and Walk for Success. Having said this, I want to congratulate everyone on an effort and performance that can be best described as above and beyond. And I want to take this opportunity to thank the Beekley Corporation for their generosity and commitment to Bristol Hospital and its community. I feel privileged and honored to be the medical director of a cause so noble and will endeavor to make strides to make it to the next level. Thank you.